When you address the topic of MRD, it's difficult to make a blanket statement about all kinds of lymphoma. I think what's most useful is to pick different lymphomas, because in a variety of different lymphomas, MRD may have different roles. I think there are two ways in which MRD is very useful. The first way is if you know that you have a disease which you're not sure you're curing, but certainly if you could beat it down to a very, very, very low level, you could get a very durable remission and hopefully a period of time when patients would not need to be on treatment. Similar to maybe how one approaches things in myeloma. So in that case, mantle cell lymphoma comes to mind, where we have ways in which we can measure that, and if we can really get a very deep response, hopefully that response would be extremely durable. And in our practice, that's something that we're starting to look at more and more. In contrast, the other place where I think MRD is very useful is when you have a disease that you know in a subset of patients can be cured. So if you can really get MRD to a level that is undetectable, that increases the likelihood that you would have cured the patient. And particularly when earlier intervention may be helpful in getting patients back into remission, being able to track and watch to make sure that the disease doesn't come back is another way in which you could really use MRD. That hasn't been quite as broadly accepted at this point, but I think there's some curious data, for example, in large cell lymphoma, where we cure a sizable subset of patients, but we obviously would like to know who is not cured and when they are at risk for relapsing. So again, work done by the NCI, for example, tracked to see when there was evidence from circulating DNA that was showing evidence for recurrence, they could identify patients earlier. Our biggest challenge there is that unlike leukemia, where that's been very important, we may not have quite the tools at this point to be able to jump in and make a dramatic difference compared to letting the disease become more clinically obvious. But I'm hoping that in the future, we will have better tools that will allow us to intervene even earlier, and then that will make a substantial difference to how we manage patients.